Heart disease is a common killer, but with early detection, it's largely preventable.
So Dr. Neel Dhudshia from Dignity Health is here to share what you should know during American Heart Awareness Month. Good morning.
Oh, thanks for having us. I appreciate it.
Yeah, thanks for being here. So on this topic, why is heart health, the month of heart health, so important for people around this time?
Good question. So I think it's, put it in context, heart disease is the #1 killer here in the United States. It kills about 100,000 people a year. So I think if we can do anything to prevent this and modify things, it goes a long way.
Yeah, obviously, like you just said, and we mentioned as well, largely preventable in a lot of cases. So what are some easy things our viewers at home can do to improve their heart and improve their health so they don't necessarily become another statistic? Great
question. So I think a lot of the risk factors, some of these are very common that you might not even think about. In fact, I think this morning on Good Morning America, they're talking about the risk of hypertension, how it's undertreated, underdiagnosed. That's a big one, pretty common. Diabetes, some other risk factors such as smoking, lack of exercise, diet's really important. And then there's things like family history. And then I know, this Friday's Go Red. And so women have some additional risk factors such as early menopause, autoimmune disorder, and inflammatory bowel disease.
Yeah, a lot of people are familiar with these types of diseases, but are there any signs or symptoms that tend to elude people that they might be going down that road?
Great question. So it's not always the classic, honey, I'm having the big one, the crushing chest pain.
Right.
It's, in fact, the majority of diabetics do not have the classic chest pain. So things such as I have jaw pain, I have some arm pain, I have some back pain on occasion, and then there's like, I'm just not feeling good today. Sometimes I'm a little short of breath, I'm just fatigued, I'm just tired today. I don't know why I'm so tired today. It could be some swelling in the legs. It could be a lot of different things. So it's important to pay attention, not just to classic chest pain. Yes, that is a symptom. It can be sharp pain, it could be pressure pain. Sometimes it could be confused for indigestion, but there's a lot of different symptoms, not just one.
Yeah, and just like the symptoms being completely different for people, the levels of exercise or physical exercise people need to do surely must be different as well. Is there a set limit that people need to do per day, or is it different from case to case and age to age?
Yeah, excellent. So exercise is exercise. It can take many forms. It doesn't have to be I'm going to go for a run, or I'm going to do elliptical, or everybody has different capability, different levels, but even 30 minutes a day of any activity, and it can be, I'm going to go to Walmart or Costco today and go shopping. That's great. I'm going to play pickleball. Great. I'm going to walk around the neighborhood. Excellent. It doesn't matter what form it comes in. It can be, I'm going to walk through the casino today. I'm going to walk the block. Exercise, and try to get at least 30 minutes a day would be ideal.
Okay.
Yeah. Earlier you mentioned family history. So if there's been a history of heart disease within the family, like let's say a parent, does that really elevate your own risk? And is that already a telltale sign that you will also experience those same things?
Yeah, excellent. So family history is one of those risk factors I say you can't change your family. So if you have family history, you have it, and it's really important to be screened and seek some whether it's a primary or cardiologist, some screening tests to help with that, because that you're at higher risk even without the risk factors that we talked about for heart disease. So it's really important that you get screened and seek attention.
Yeah, there may be someone watching today who, after hearing you say it's not the normal, it doesn't have to be the big chest pain.
Absolutely.
It could be back pain, it could be feeling tired.
Absolutely.
If someone is watching right now and thinking, oh my goodness, I'm concerned, I think I might have heart disease, what should the first steps be? What should they do?
Excellent. So I think it depends on your level of severity of symptoms. So if you're having obviously horrible, I can't breathe, I have chest pain, every day, then maybe a little more of acute. There's a bunch of, not just the ERs, but there's some micro hospitals around town. If it's something like, this has been going on for a month or so, then I think you can seek attention with your primary care provider, or if you have one, maybe they will recommend a cardiologist for more testing. There's a lot, and the good thing is this day and age is as technology evolves, the technology for detection has gotten better. There's things like calcium score, they're easy to do. There's some CRP, some blood work that, you know, nothing's perfect, but it's better, lipoprotein A, and then the classic, like, you know, triglycerides, cholesterol, and those parameters that but the technology gets better, the testing gets better.
Go and see someone, get yourself checked out.
Yes, Dr.
Yeah.
Dhudshia, thank you so much for
thank
joining
you.
us this
Yeah.
morning. Make sure you are taking care of yourself and know your own risks. And for more information or to contact Dignity Health, go to dignityhealth.org/NVHeart.